In the clinic, we use a few different tests and screens to help us diagnose and guide our decision making around lumbar instability. Depending on what tests we show positive findings in, that can help guide some of the rehab plan as well. A few of the tests that we're going to go over today are the apprehension sign, the instability catch sign, active straight leg raise, and our breathing assessment. Apprehension sign is pretty simple, where we are just going to ask the patient if they had any sensation or occurrences of their lower back collapsing or giving way during transitional movements like going from sitting to standing or potentially getting up from the ground. The next screen is instability catch sign, where we are going to have the patient stand up on their feet and then reach down towards their toes and come back. As a clinician, we're watching to see what that movement looks like. We're looking for any abnormal movements or motions that are indicating lumbar instability. So we might see pain with that movement, up or down. We also could see a catch at a certain point through the movement. Sometimes we'll see walking back up with the hands on the legs. We will then have the patient do the movement again while they are bracing their core muscles. And if we see an improvement in that ability to go up and down, then we are suspecting lumbar instability. The next test we're going to look at is the active straight leg raise test. So we'll have a patient lie on their back, and from here we're going to have them lift their legs up as high as they can, and if the patient can move their legs further than an average of 90 degrees, so that'd be straight up or beyond, then lumbar instability is more likely. The last test we're going to cover is our breathing assessment. So we're looking for signs of dysfunctional breathing patterns, and some of those include an initiation of breathing from the upper chest. So if the chest is rising through a normal inhalation, nasal flaring, frequent yawning. We're also looking for mouth breathing, inadequate or asymmetrical expansion of the lateral, so outside rib cage. And to screen out where the breath is being initiated from a little further, we'll have a patient lying on their back with one hand on the abdomen, the other hand on their chest. And what we want to see is about, through a deep breath, we want to see about 90% of the movement coming from the hand on the abdomen. So we just take a deep breath in, and we can see my lower hand moves a little bit more. What we don't want to see is the upper hand rising first or predominantly. So if I take a chest breath like that, you see this hand moves a lot more, not a lot of movement down low. Those are a few of the signs and tests that we look for in aiding our decision-making processes around lumbar instability.